Good morning, and thank you for joining us for SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton. Very excited today to bring on one of our partners from Barrington Terrace of Naples, Miss Tammy DeCaro. How are you?
I'm fantastic. How are you today?
I'm good. Thank you for asking. Well, I am really excited to have you on the show. You are definitely an idol of mine, especially during this time. Um, Tell me a little bit about yourself, your background, and a little bit about the community that you're representing today.
Sure. I was just looking at this the other day, and believe it or not, I've been in healthcare for 25 years. I was adding up all those days and saying, wow, I can't believe. In some ways, it feels like forever, and in some ways, it feels like it was yesterday. So I have been the executive director here at Barrington Terrace for 6 years. And prior to that, I was with hospice for over 10 years and have a long history with long-term care insurance and training and management, as well as healthcare administration in a variety of environments. So it's interesting, working in assisted living, it kind of combines a little bit of everything, the home health, the private duty, hospice. I get to do a little bit of all of it. So that's what I love about this industry, is it's constantly changing and different, and certainly no more that so than right now during COVID-19.
For sure. And speaking of right now, I know that it changes on the regular. Do you want to talk to us about some of the regulations for testing your residents and your staff?
Yes, so in the past week, we've had some really, actually since the beginning of September, some really groundbreaking changes to the way life has been for long-term care. And when I say long-term care, I mean assisted living facilities as well as skilled nursing facilities. So some people will call skilled nursing facilities a nursing home. An assisted living facility is a different type of license, but we're all under this long-term care umbrella. And on Friday, we were notified by ACA, which is the Association for Healthcare Administration, that is the governing body for assisted living, that we no longer have to test our staff every 2 weeks for COVID-19 as of tomorrow. So that changes tomorrow. The emergency order expires. So for assisted living, there is no state testing requirement. What's interesting is the past 2 weeks have been very confusing as a executive director of assisted living, because one day we hear one rule, and then we hear another rule, and then we hear, oh, this is going to change, but we're still going to provide testing. And then finally all the final documents came out Friday night. So the reason I think it's important to understand the difference between assisted living and skilled nursing is because skilled nursing facilities, the nursing homes, will have a different set of testing guidelines, which is dictated by CMS, that's the Centers for Medicare Services. And CMS will continue to require staff testing and resident testing in some cases where there's an outbreak, but it's based on county positivity rate. So this is something new for all of us to have to know and deal with. There's a lot of confusion on which county positivity rate are we looking at? Where do we get that number? Because if you watch the local statistics at all, one day could be 4%, the next day could be 6%. The reason that's important is because if the county positivity rate is less than 5%, the facility has to test their staff once a month. If the county positivity rate is between 5 and 10%, it's weekly. And if it goes over 10%, it's twice a week. This is a huge change from our every 2-week testing requirement, and a lot of assisted living and skilled nursing facilities have been kind of in limbo, waiting on this rule to come through, and really not quite sure what was going to happen in the assisted living world, because CMS was saying that they were going to require us to do it, but we don't actually have to. So, again, to recap, your assisted living facility will have no state requirement for staff testing, but your skilled nursing facility will. And that will be based on the county positivity rate. I would encourage any of your viewers that are interested in looking at assisted living or nursing homes, skilled nursing facilities, to talk to those facilities and find out if their company is going to continue to test. Most of us have a lab provider already. I know for Barrington Terrace, we have a private lab, but we also were offered the option to go with the state provided lab on a private contract.
Mhm.
So many facilities will probably still test. And those are great questions when you're talking to assisted living communities, asking those questions. Are you testing your staff? What is your policy?
No, I couldn't agree.
So that was one of the reasons I wanted to come on your show, is to share that info.
No, I couldn't agree more. It's definitely one of the questions that you should be asking. And I know there's a lot of confusion out there on requirements of not only staff and vendors, if you will, but what about the confusion with visitation? The governor's order doesn't necessarily mean drop by your assisted living and visit grandma. So talk to us a little bit about the governor's order and the things that we really need to know.
Absolutely. So, September, like I said, has been the season of change so far. Today's only, halfway into the month, and or a little over half, and we've had 2 big changes. So another big change that happened on September 1st is that Governor DeSantis announced that the visitation rule that was in place all summer under an emergency order was expiring as well, and that assisted living facilities and skilled nursing facilities should be preparing their policies and procedures to allow for a visitation. Now, visitation has 3 different categories. So it is very important for people who are looking for an assisted living community to ask to see their visitation policy and procedure, and ask those questions, and then find out what the general visitation policy is. So under the assisted living guidelines for most communities, there are compassionate visits, which I think, I speak for most assisted living communities when I say that throughout the whole COVID-19 pandemic, we have allowed compassionate visits. Compassionate visits would be someone who's visiting at the end of life, or in a case that happened to a friend of mine, her sister passed away unexpectedly. They went to the community with their mom to explain what happened. And that was a compassionate visit. It's short term. It's meant for something that's, a compassionate visit, end of life or bad news, something, to comfort them. And those visits have been happening, I think, during the pandemic for most communities, but the visitation order does include that. And then general visitation will be interesting now that Friday's news has come about with the new testing change, because general visitation is dependent upon your facility not having any COVID positive residents or staff within the previous 14 days. So most communities, if you look at the data, have at least one asymptomatic positive almost every testing cycle. And usually it's staff. So, that's going to be interesting. It's super important for people who are looking at assisted living or already have a family member living in assisted living to reach out and talk to that community if they haven't already notified you. Give them a chance to develop their policies and procedures. Unfortunately, the governor threw this on everyone in a press conference, did not tell the facilities this was happening. So no policies were ready. And especially a lot of corporately owned assisted living communities and skilled nursing facilities are having to deal with their corporate office to develop, policies and procedures. But it is critical to find out how each community is going to do that visitation.
Yeah, I would say that was a surprise to all of us. And I know that you guys are the healthcare heroes and the forefronts of all of this. And it's going to be very difficult to turn a family member away when they say, "Oh, the governor said I could come see grandma."
Yes. Yes, we had people arriving and calling that day.
Yeah.
And so I think it's also probably a really good time to talk about what does that visitation look like?
Mm-hmm.
So under the governor's emergency order, the community does have a lot of leeway in how they do that visit. It can be outside, it can be inside. The facility may require that the family get tested. It is not every relative and their neighbor and the 5 ladies from the church. It is 5 designated general visitors over the age of 18 in a very specific set aside area by appointment, either inside or outside. It has to be socially distanced. The visitor needs to bring their own mask, and it says PPE, but the facility is supposed to provide an area for hand sanitation or hand washing prior to and after the visit. But I think this is a constantly evolving process. And I think for families wanting to visit, we know that you want to visit. We know your residents want you to visit, but we also want people to be safe. And I think it's important to connect with your community, find out if they have had previous positives. And if they have had, give them a little time to work through that. And if they have not notified you of their visiting policy, certainly ask those questions, but give them a little bit of time. We really, as an industry, knew that there was a task force convened on visitation, but as long as most of these emergency orders took this summer to get put in place, we did not expect this order to come through as quickly as it did. And certainly, many of us had plans already in place, but it takes some effort and time to make sure you have the right location. And with the rain outside right now, some facilities are having that challenge.
I'm sure. Yeah. Well, tell me, I know that this has been probably one of the biggest challenges with COVID, but talk to us about some of the other challenges, that senior living communities are facing.
So I think, when you look at, as an assisted living executive director, one of the biggest issues that we've had has just been controlling the spread of this virus. It is unseen, and unfortunately there are a lot of asymptomatic carriers. And again, back to the visitation, just be aware of the fact that when you visit that community with your mom or dad or grandma, it's highly possible that you could be giving that loved one something that could be very detrimental to them. So that's so important to have good hand washing, keep yourself healthy. Don't, have risky behavior, wear your mask when you're out in public, so that you can continue to visit. We have seen so many situations where, several staff will test positive, none with symptoms, and then one resident will get that COVID-19 infection, and it can be very detrimental and very dangerous for that person. So, there's a reason why, particularly when you look at long-term care, every healthcare expert has said underlying medical conditions and the frail elderly population are the highest risk. And we've certainly lived that this summer. So, alternative is to not have visitation, which I also don't think is good for the mental health of our residents. We did a lot of Zoom, just like we're doing now, which is awesome. We had some Zoom weddings. We had a Zoom funeral that we attended. One of our residents attended a Zoom funeral. And I think everyone has kind of gotten used to this electronic digital connection. But, when you do get a chance to visit mom or dad in that assisted living community, please resist the urge to hug them, do an air hug or something like that, something safe.
Yeah, I think that by far would be what I would say has been the hardest for even myself, is the no hugging.
Yes, yes. And just even shaking hands, when you're meeting someone.
Yeah.
For all of us, we've had to learn how to do things differently. We're doing care plan conferences on Zoom. which is, you have 8 people involved in a care plan conference. So that's been interesting. And it's really takes a little bit longer because everybody has to have a chance to, where you can usually pass a care plan to someone and say, hey, do you agree with this? And what would you add? It takes a little bit more effort. The last thing I do want to make sure I mention is so important. If you're thinking about visiting someone in an assisted living or skilled nursing community, please, please, please get your flu shot. We're seeing already a rapid rise of flu shots or flu cases. So, so important.
Yeah, I was just going to say, definitely talk a little bit about that, because I think that there's probably a lot of asymptomatic people that walk around with the flu. So get the vaccine that's available to you, because here again, it does affect our frail elderly population. And just as we need to protect them from COVID, we need to protect them from the flu. And this has been a very serious lesson to everyone regarding that.
Mm-hmm. Absolutely. I spoke with a family member yesterday who got the flu, and because she was almost recovered from the flu, and she was already compromised, she also contracted COVID. So she had both. And yeah, so, I'm sorry.
Double whammy.
Yes,
there.
Exactly. So important to make sure now that visitation is opening up in assisted living facilities that you take your temperature before you go, make sure you haven't had any exposure. You will be screened, you'll have your temperature taken. You will also be asked if you've been exposed to anyone with COVID-19. Do you have any symptoms, which would be fever, cough, shortness of breath, body aches, chills, loss of taste or loss of smell, diarrhea, nausea, vomiting. I know them all by now.
Yeah, you can be on one of the commercials.
I don't even have a cheat sheet. And headaches. So those are, I laugh when I hear those symptoms, because I said we need a symptom checker for over 50, because I could check off half of those just because of age. But I do think it's important to do a check of yourself just mentally. Am I feeling run down? Am I feeling anything? And if you are, take a few days off and don't visit, reschedule your visit, make sure everybody stays safe and healthy.
You're absolutely right. Well, thank you so much for your time. I know how busy you are. You're the executive director for Barrington Terrace down in Naples. Do you want to tell everybody where you are, where you're located, and a little tidbit on the community itself, because we focused a lot on other stuff?
Sure, absolutely. So we are in the East Naples, or yes, I did, because technically East Naples, at Rattlesnake Hammock and 41. We also have a location in Fort Myers by Health Park Hospital on Commerce Center Drive. We are known for our absolute best level of care and long tenure of staff and leadership. What's interesting is I'm also a doctoral student in leadership. So little fun fact, the greatest influence on caregiver tenure in healthcare is nursing director tenure. So if the nursing director has been there for a long time, then they tend to have a stable and very long tenured caregiving staff. And that is true of us here in Naples. Our nursing director has been here 15 years, and we have caregivers who have been here longer than that. So
wow.
That's and this is an industry with a 70% turnover rate of healthcare. Yeah.
That speaks volumes for your community, and it is absolutely beautiful. If people wanted to come and visit, I'll make sure to put the contact information to call ahead and see when visitations are going to be starting back up at Barrington Terrace.
Awesome. Thank you.
Thanks again, Tammy. Have a good